Next slide, please. So again, HRSA supports more than 90 programs that provide health care to people who are, as Shannon indicated, geographically isolated or medically challenged. And HRSA does this through grants and cooperative agreements. We currently have more than 3,000 grantees, including community-based organizations, colleges and universities, hospitals, and tribes or tribal governments. Every year, HRSA serves tens of millions of people, including people living with HIV/AIDS, pregnant women, mothers and their families, and those otherwise unable to access quality health care. Next slide. So our strategic plan, there are 5 sections to it. The first section is to improve access to quality health care and services. Then there's strengthening the health workforce, building healthy communities, improving health equity, and strengthening HRSA program management and operations. Next slide. This is our organizational structure, and the boxes along the bottom row are probably the most important. It are those that provide the funding opportunities. And so we'll go over each of those boxes, starting with the next slide. Well, actually, we have a little bit about our budget. For fiscal year 2018, the current fiscal year, our budget is about $11.5 billion. And so then you see next to it the fiscal year 2019 request, which is considerably less, but you know, between now and when the budget is set for fiscal year 19, no telling what that amount would be. Next slide, please. So here's the health center program out of our HRSA's Bureau of Primary Health Care. There are roughly 1,400 HRSA-supported health centers operating more than 10,000 service delivery sites across the country. There's nearly 26 million people. That equates to roughly 1 in 12 people nationwide that rely on a health center for their primary care. Those 26 million people include 1 in 3 people living below the federal poverty level, 1 in 6 rural residents, 1 in 10 children across the country, over 300,000 veterans, and over 300,000 American Indian Alaskan natives. Next slide, please. So the health center program, the Bureau of Primary Care, which administers the health center program, has done a lot of work to ensure that not only is access afforded to the underserved, but that the care they receive in the health centers is quality care. And so these bullet points here reflect the Bureau of Primary Health Care's emphasis on quality of care. 68% of diabetic health center patients have their diabetes controlled, and that exceeds the national average. 62% of hypertensive patients have their blood pressure controlled, and that exceeds the national average. 63% of pediatric patients received weight assessment and counseling for nutrition and physical activity, compared to private sector provider scores of 46% for weight assessment and 47% for nutritional counseling, and a little bit over 40% for physical activity counseling. 60% of patients that receive their care at health centers are screened for depression, and that exceeds national screening rates of 4.2% in office-based primary care settings. And 67% of health centers are recognized as patient-centered medical homes. So again, a testament to the quality of the care delivered by community health centers. Next slide, please. HRSA's HIV/AIDS Bureau administers the Ryan White program, and these are grants to cities, states, local communities to provide HIV care and treatment services to low-income people living with HIV. More than half the people living with HIV in the U.S., more than 500,000 people, that is, receive services through the HRSA-funded Ryan White program. 85% of Ryan White HIV clients are virally suppressed, and that's up from 70% in 2010, and that exceeds the national average of 58%. Next slide, please. HRSA's Maternal and Child Health Bureau administers the Maternal and Child Health Block Grant. These are grants to states, territories to provide health care and services to nearly 54 million mothers and children in the U.S., including 2/3 of all pregnant women and 1/2 of all infants and children. Note that between 2000 and 2015, nationally, the infant mortality rate declined by 15%, and the child mortality rate declined by 24%. Next slide, please. The Maternal and Child Health Bureau also administers the Maternal, Infant, and Early Childhood Home Visiting Program, and these are grants to states, territories, and tribal entities that support voluntary, evidence-based home visiting services for at-risk pregnant women and parents with young children. In fiscal year 16, over 160,000 parents and children nationwide received HRSA-supported home visiting services. Research shows that home visits improve the lives of children and families by preventing child abuse and neglect, improving maternal and child health, and promoting child development and school readiness. Now, another program not mentioned here, but worthy of mention, is the HRSA-funded Healthy Start program, which provides an array of services, case management, et cetera, to pregnant mothers and mothers with young children. And I note that because one of the Healthy Start grantees is the Great Plains Tribal Chairman's Health Board. Next slide, please. HRSA's Federal Office of Rural Health Policy provides support to the offices of the Secretary and supports a number of rural health programs, including rural health networks, black lung clinics, telehealth, and Veterans Rural Health Access programs. Of note, HRSA has the Telehealth Network Grant Program, which supports the delivery of services via telehealth. And it also has what is called the Medicare Rural Hospital Flexibility Program, where it provides support to critical access hospitals. And in this instance, it supports what is called the Medicare Beneficiary Quality Improvement Program, which attempts to improve the quality of care provided in critical access hospitals. Next slide, please. HRSA's Health Systems Bureau provides services and resources regarding organ transplantation. It maintains a registry of people who have decided to donate their organs if need be. Over 130 million people are registered to be organ donors. That's an all-time high. Over 16 million are registered to be bone marrow donors. And in 2016, HRSA supported transplantation programs that led to over 33,000 organ transplants and over 6,000 bone marrow and cord blood transplants. HRSA's Health Care Systems Bureau also administers the 340B drug pricing program. And that program enables drug manufacturers to provide discounts to eligible entities that meet certain criteria for serving underserved patients. Qualified safety net organizations obtain a 25 to 50% discount on outpatient drugs, and sales that totaled over $16 billion in 2016. Next slide. HRSA administers the graduate medical education programs. The Children's Hospital Graduate Medical Education Program provides funding to freestanding children's hospitals across the country, and the intent is to support the training of pediatric residents and pediatric subspecialty residents. And then there is the Teaching Health Center Graduate Medical Education Program. It supports primary care and dental residency programs in rural and underserved areas in community-based settings. Next slide. HRSA, through the Bureau of Health Workforce, administers the National Health Service Corps and Nurse Corps programs. And through these programs, over 12,000 scholarships and loan repayments are made in exchange for a clinician's service in high-need areas. And so as we speak, there are many IHS facilities as well as tribal facilities that house either National Service Corps loan repayers or scholars or Nurse Corps supported people. The National Service Corps and the Nurse Corps clinicians provide care to more than 12 million people nationwide, including over 3.5 million rural residents. Next slide. Wanted to note, HRSA does have an Office of Health Equity, and that office released HRSA's Health Equity Report in March of this year. The report presents trends for a number of program areas such as maternal and child health, primary health care, healthcare systems, HIV/AIDS, mental and behavioral health. It presents information in terms of rural and urban, and it also talks about geographic disparities among various population groups, including American Indians and Alaska Natives. And there's the link to that program, that report. Next slide. Here's the HRSA regional office configuration, and it varies from the Indian Health Service area office configuration. But all to say, we're in 10 regions, and there's the Denver region in violet. And note that the Great Plains region, as configured by the Indian Health Service, includes parts of our region, which would be North and South Dakota, as well as the Kansas City region in green there, Iowa and Nebraska. Next slide, please. So I work with the Office of Regional Operations, and our mission is to improve health equity in underserved communities through outreach and education, technical assistance, and partnering with local, state, federal, and tribal organizations. Next slide, please. HRSA's national network of 10 regional offices increase access to quality of care, information, and resources. Again, we're conducting outreach and providing assistance to HRSA grantees, targeted populations, and stakeholders, including tribes, tribal organizations. We're partnering with and convening stakeholders to advance HRSA priorities. We're here to extend the reach of HRSA's bureau and office programs that I just mentioned. We're representing HRSA at meetings and events, and we're identifying emerging state trends, priorities, and strategies. Next slide, please. Here's the array of partners and stakeholders we work with. You see several federal agencies, state governments, obviously the Indian Health Service. You see tribal governments, tribal councils, any organization at any level that has an interest in and can contribute to strengthening healthcare for the underserved are organizations we partner with. Next slide, please. So the Office of Regional Operations, HRSA's Office of Regional Operations supports American Indian and Alaska Native communities by reducing the burden of disease, increasing health professional workforce development, improving health information technology investments, and improving access to funding and grant opportunities. Next slide. Here are some of the interventions in the main: providing technical assistance or convening national, regional, or local events. What we've accomplished to date, we've increased the number of tribal members receiving grants writing training. We've increased the number of tribes receiving HRSA grants. We've established long-lasting partnerships with federal and tribal, state, local stakeholders to address pressing needs impacting tribal communities. And we've trained more tribal clinical providers and tribal leaders according to targeted interventions. Next slide.
Sorry.
From this office, we provide outreach and education, and for instance, grants training workshops, one-on-one technical assistance on how to apply for HRSA funding, and we provide tailored outreach and education. That is projects, partnerships, presentations on a range of topics such as tribal youth suicide prevention and increasing the utilization of diabetes prevention programs and diabetes self-management education. Next slide, please. We are engaging with state and tribal governments, such as suicide prevention partnerships with state health departments. We're partnering with states on opioid abuse prevention strategies. We're facilitating the sharing of information between state health departments and tribes. And we're strengthening affiliations between the IHS and tribal health clinics and other safety clinics. Next slide. Again, out of Denver, we have several special initiatives and partnerships, including we have a Region VIII opioid consultation team. We're working on perinatal and infant drug exposure in Montana. We're working to advance the integration of suicide prevention activities into clinical settings. In terms of workforce development, we're strengthening ties between state university systems and tribes to increase health career opportunity programs. And we're working to increase the number of veterans who can find employment in healthcare settings. In terms of chronic disease prevention, we're facilitating partnerships with USDA extension agents, safety net clinics, USDA rural development to strengthen linkages between clinics and community-based organizations. Next slide. Here's an example of the type of work we do. The Oglala Lakota Workforce Partnership. And so this is a project I worked on. What we started by reaching out to key tribal organizations on the Pine Ridge Reservation or nearby to build support for a workforce initiative. Thinking back, 2015, I believe, there was a rash of youth suicides on the Pine Ridge Reservation. And so the thought here was, what would be a strategy to both involve youth in something that was career-oriented, as well as increase the number of tribal members that are able to become clinical professionals and provide care on the reservation. So as a first step, we reached out to organizations with key roles on the Pine Ridge Reservation, such as the IHS Service Unit, Oglala Lakota College, the Oglala Sioux Tribal Health Administration, Oglala Lakota Nation Education Coalition, and of course the Great Plains Tribal Chairman's Health Board. And we asked if they would be interested in partnering, again, to increase health career opportunities for American Indian youth. At the same time, we reached out to HRSA's traditional workforce partners, such as the South Dakota School of Medicine, College of Nursing, South Dakota Area Education, Health Education Center, South Dakota Department of Health, as well as Rapid City Regional, and we asked them the same question. And so this first step was essential and led to a couple of key next steps. If you could go to the next slide. We convened a summit in Rapid City in the summer of 2016, where representatives of 30 organizations, mostly tribal organizations, shared ideas, identified gaps and challenges, and strategized about solutions. We convened a follow-up summit last May of 2017 in Rapid City. And there we focused more on what was happening in the K through 12 environment on the reservation. And so we invited current Native American health professionals from the Pine Ridge Reservation to talk about their experiences, their lessons learned, and how education could be improved on the reservation to increase the number of tribal members entering health careers. We also talked about curriculum development, that is preparing American Indian youth for health professions training. And then we provided information to those at that meeting about making use of existing health careers programs in South Dakota. And so what resulted from those two summits was that a core partnership, some of the core partners of this Oglala Lakota Workforce Partnership prepared a HRSA application for planning. And their plan essentially proposes to strengthen the network of organizations that are focused on the development of health career opportunity programs for American Indian youth, not just on the Pine Ridge Reservation, but across the Great Plains area. So again, an example of the type of work that we do here from the HRSA Regional Office in Denver. Next slide, please. So here's some HRSA-funded tools and resources thought you'd be interested in. Next slide. The first is the SAMHSA HRSA Center for Integrated Health Solutions. And here, this one provides technical assistance, again, for organizations interested in strengthening or learning about how they can strengthen the integration of primary care and behavioral health in their particular clinics. And you see the website there. Next slide. Again, another website on integrated care. This one is actually administered by the Substance Abuse and Mental Health Services Administration, a sister agency of HRSA and the Indian Health Service. Keep in mind, these tools and trainings are free, and you could use them any way you'd like to. Again, the link is there. Next slide. Again, we have a technical assistance available if interested on HIV and AIDS. In this case, it would be through the Mountain West AIDS Education and Training Center. And there's the contact. If you would like information or assistance with HIV and AIDS. Just as a reminder, with regard to testing, there is the HIV.gov website where you can find places to get tested for HIV and AIDS confidentially. Here's a HRSA-funded tool with regard to maternal and child health. It's called the MCH Navigator. And so again, you have the website there. This website will take you to, it's basically an online learning portal, webcasts, instructional modules, lectures, etc. mchnavigator.org. Here's the MCH Life Course Toolbox. It's a way, the Life Course perspective is a way of looking at health. It's an integrated continuum across one's whole life. There are many facets in life contributing to health outcomes. And the Life Course builds on public health and social science literature, which highlight the influence of each stage of life on the next. And it shows how social and economic and physical environments interact to impact on one's health, one's life, and the community. Next slide, please. Again, here's the National Health Service Corps, spoke of earlier, and there's the website for individuals interested in either loan repayment, if they've been trained as in a clinical profession, and or if they are currently in training for a clinical profession and are interested in a scholarship. Next slide. And again, HRSA also supports the Nurse Corps program for both those studying to be nurses as well as existing nurses. There is the loan repayment and scholarship programs. Next slide. There's a HRSA-funded tool on obesity prevention. It's specifically about rural obesity prevention. You see the website there. This toolkit has 7 modules, each concentrating on a different aspect of obesity prevention. And so another HRSA-supported tool. There is the Rural Diabetes Prevention and Management Toolkit. Again, this toolkit has 7 modules. And you can pick and choose which modules are of interest to you, your clinic, your community. HRSA supports across the country telehealth resource centers. And these are organizations designed to provide technical assistance to interested clinics and organizations who want to either begin, develop the capacity to provide services through telehealth or strengthen their existing telehealth programs. The telehealthresourcecenter.org would be the website to go to find the telehealth resource center serving the Great Plains area, which happens to be the Great Plains Telehealth Resource Center, GP Track as it's called. And so again, HRSA is unique in that not only does it provide grants to deliver services via telehealth, but it supports a network of telehealth resource centers around the country to help grantees and others. Next slide. Just wanted to remind folks of the Department of Health and Human Services 5-point strategy to combat the opioid crisis. And that is better addiction prevention, treatment and recovery services, better data, better pain management, better targeting of overdose reversing drugs, and better research. I wanted to note there is an upcoming funding opportunity of which tribes are eligible to apply. And this is called the Rural Communities Opioid Response Planning Initiative. It's due out any day. Applicants will have about 60 days to prepare an application. HRSA plans to award up to 75 planning grants. These would be $200,000 planning grants for 1 year to develop plans to implement opioid use disorder prevention, treatment, and recovery. The initiative will focus on high-risk rural communities and tribal communities. And applicants are asked to form a consortium with a lead applicant and at least 3 partners. All domestic, public, and private entities, nonprofit, for-profit, are eligible, including tribes, tribal organizations. Again, notice of funding opportunity will be out any day now. I know from this office, we've already contacted several tribal organizations to at least make them aware of this prospective funding opportunity, including the Great Plains Tribal Chairman's Health Board. Next slide, please. So there is a Rural Prevention and Treatment of Substance Abuse Toolkit, likewise supported by HRSA. This toolkit provides helpful information that can be used by your organizations to implement substance abuse prevention and treatment programs. And again, 7 modules you can pick and choose from. Next slide. I wanted to note a future funding opportunity, the Small Healthcare Provider Quality Improvement Program. This will likely be out in the winter of 2019, say around late December, early January. It supports rural primary care providers and their ability to plan and implement quality improvement activities. The focus is on patients with the highest healthcare utilization due to chronic disease, such as diabetes and cardiovascular disease. The key elements of this funding opportunity and that which the applicant needs to address is to identify a patient population to track over the 3-year grant period, implement an evidence-based quality improvement model to improve care, and use health information technology to collect, report, and utilize information on cost and quality. Again, that's the Small Healthcare Provider Quality Improvement Program, and tribes can apply for this as a means to complement their existing Special Diabetes Program for Indians funding from the Indian Health Service. Next slide, please. HRSA has a HRSA-funded tool on substance abuse called the Substance Abuse Warm Line. The Warm Line provides peer-to-peer consultation from physicians, clinical pharmacists, and nurses with special expertise in substance abuse evaluation and management. And there is the Warm Line toll-free number. Next slide. HRSA funds poison control centers across the country. 55 of them, poison control centers, are HRSA funded. And it likewise supports the establishment of a poison helpline, 222-1222. Next slide, please. So, in closing, when might you contact us here at the Office of Regional Operations in Denver? When you have questions about other HRSA or HHS programs, data, resources, etc., or when you'd like to connect with other HRSA or HHS programs, would be one reason to contact us. When you're looking for a new type of partner or resource or funding opportunities, when you'd like to share information with us that may help make decisions or inform our activities and programming, or when you'd like us to represent, attend a meeting or an event, or you have an idea for a partnership between tribal organizations and other organizations, whether they're HRSA funded or non-HRSA funded. And we've done a lot of partnership building for tribes. And so there's our website, HRSA.gov. And that concludes my presentation. I'll turn it back over to Jennifer and Shannon.
Thank you, Nick. Does anyone have any questions for Nick?
I actually have a question. Nick, I was just wondering, in regards of the telehealth, have there been a lot of success with that in different tribal communities or reservations?
Well, we have recent experience with 2 tribes in this region that have received HRSA telehealth funding. And one, in fact, is the Oglala Lakota. And they received telehealth funding to support services provided to, I believe it's K through 6 children in schools on the reservation.
Oh.
And the idea there was, and it was behavioral health oriented. And so if in the observation of the teachers and faculty at a particular school, there was a child that they thought needed to be observed, of course, with parental permission, they had the ability to, directly from the school, connect with a clinician, a healthcare professional who could provide at least initial assessment and suggestions for future treatment. And I believe that program exists and is up and running in some of the schools on the Pine Ridge Reservation.
Okay, thank you.
Yep.
I have entered our evaluation feedback form in the chat box. If everyone could follow that link and fill out a feedback form, we would really appreciate it. Does anyone else have any other questions for Nick? I think this has been recorded, so we will be sending out the YouTube link to the video in a follow-up email. So be on the lookout for that. Otherwise, thank you so much for joining us today, and I hope you guys all have a great day.
Thank you. Thank you, Nick, very much.
You're welcome. Have a good day.